hello, beautiful souls, and welcome to another episode of the Indigo Womb Wisdom Podcast. I'm your host and sister friend, Shatia Tee Owsley, and thank you for watching and or listening. So sit back, grab some tea and a notebook, and let's vibe together as we have organic and practical conversations embracing intuitive womb wisdom, spirituality, and a sprinkle of magic to rebel, restore, and radiate overall wellness in our lives. Hey everybody, thank you guys for joining us again today for Indigo Womb Wisdom on the podcast today. I would like to introduce our guest, Charnise Littles. She is a doula in an IBCLC. Charnise is the founder of birthandmilkco, located in the Washington, D.C. metro area, specifically Prince George's County. And she provides virtual and in-birth doula and lactation services. I'm so excited to have you here today.
Glad to be here.
I know you was working. You've been working for the last 2 days.
Oh, y'all don't even know.
I said, it's my boo. Is she gonna make it today? Is she gonna make it? I don't know. They got her in these births back to back.
They got me in the streets. First of all, 2025 has dragged me from the very beginning. Literally was pushing with the client at midnight into the new year. And it's been like nonstop ever since. It's a blessing.
Yes. Well, I'm so happy that you made it today. And I know you got some gems to drop. But most importantly, I would like for you to just talk about your background. Who are you? Who's Miss Littles?
Yes. I always say first and foremost, of course, I'm like, I'm a child of God.
Yes.
But I'm a mom. I feel like that is always like most important. I'm a mama to my 10-year-old son. I'm a guardian to my 16-year-old cousin, daughter, so heavy in the family life. What do I love? I love journaling and meditating and reading and eating crabs and a glass of Cabernet and out brunching with the friends. I'm always like, I'm a person first. Like,
yes.
The profession is awesome. The profession is great and the work we do is amazing.
Yeah.
But at the core, we're all people, we're all human.
Mm-hmm.
So always that first. And then after that comes the roles and like the life of service. So service is very heavy in the core of who I am, and the way that I serve my community, the people, is through birth work.
Yeah.
So as a birth doula and as an international board certified lactation consultant in these streets, helping people feed their people.
Yes.
And helping families expand as we navigate this world of maternal and child health and birthing. Ooh, it's a whirlwind.
Yes. So how did you get started in birth? Have you always wanted to be in the wellness arena or what?
I can say that, yeah.
Okay.
In terms of the wellness arena, I can say yes. When I was growing up, if somebody was like, what are you going to be? It was giving pediatrician. I love my pediatricians. When I was growing up and in the area, they're really awesome. I wanted to always like help the babes. So that was always the goal. But it definitely did not necessarily a 360, well, kind of a 360 because it's just similar realm. But in college, it really kind of shifted my perspective when it came to like what I was passionate about. And part of that was getting pregnant my senior year at Howard University. And honestly, it was like a catapult. I feel like. So before I realized I was expecting, I was doing a lot of studying with health science, health education, community health, just heavy into it all. And I did this crazy intensive on maternal and child health. My professor was like, hey, you should study this. Like, we're doing an intensive, it's sponsored, so you don't got to pay for the credits. Mm-hmm. Get into it for a second.
Yes.
And see how I feel. And I was like, there is no reason to say no to that. So that is what I did. And I learned wild things, like crazy wild things. And of course, everyone's hearing often now in the media and the news, all the things about maternal mortality, about what does it mean to be healthy in birthing? What does it mean to be Black, healthy in birthing? Because those are very different things. Learned a lot about breastfeeding. And maybe a month after doing that, I realized I was pregnant. And I was like, oh, I get to try to do some of these things that I learned and see how that is like translating. And it was mind blowing. I tell folks all the time, the craziest facts that truly blow my mind like till this day, is when you look at the top 5 reasons why Black women die in the US and you look at the benefits of breastfeeding, 4 out of 5 is the same list. But then when you look at the statistics in terms of who breastfeeds longer, who exclusively breastfeeds the most, all of that other stuff, Black women, we're at the bottom of the list. And I'm like, my mama had breast cancer. We hear about this with our family and friends all the time. We hear about heart disease and health. We hear about diabetes a lot. I'm like, why are we not protecting ourselves? I can't say what I want to say, but I'd be like, forget these kids.
Right.
Like, what? What are we
Right.
talking about these kids? I'm like, oh my gosh, it's really about us.
Yes.
Right. And so I was like, okay, let me try the things. And so at that time, I was pregnant at 21, probably turned 22 about a month after I had him. Started realizing that the people who were getting pregnant after me were not, they were not informed. And I'm a very true believer in if we don't even know the information, we can't even make a choice of our own because we don't even know the options. We have to know the options to make informed choices. And if we don't have those options or know about them, we can't really make the best decisions for ourselves because we don't even know what's out there. And so I just started telling family and friends what's out there. I'm like, hey, y'all know about this? Like, do y'all know what your birthing facility offers? Do you know like what kind of provider you want to have? Do you know there's more than one provider that can catch your baby?
Yes.
Do you know that you deliver your baby and they catch it?
Right.
It's just like all the things. And so it was really cool kind of having those conversations with family and friends and being invited to delivery. I thought it was normal. I was like, oh yeah, everybody goes to their best friend's delivery. Everybody goes see they're like, no girl, that is not how this works.
Yes.
And I was like, what you mean? Like I've seen like 2, 3 people push their baby out and they're like, no, it's you.
Me too. Me too.
That is not how this works in the real world. Everybody's not looking at our Thundercat. Like, that is not how this goes. And I'm like, okay, cool. So, yeah. So my family and my friends were just like, maybe you should try doing this for other people. Like, maybe, educate them, spend this time with them like you're spending with us, and see how it feels. And at that point, I was deep in lactation just because I was breastfeeding my son. I had an internship at Howard after coming back after having my baby, really looking at how hospital-based lactation support was helping folks and not helping folks enough. And then kind of going from there and getting trained in lactation as a breastfeeding peer counselor, working for the WIC office, and really just like being in community and being with the people and really being like, hey, y'all, I'm feeding this baby and y'all can feed yours too. Like,
Right.
we can do this together.
Yes.
It can work. And learning about the clinical aspects of it. Because when I got into all of this, I had no idea about the clinical side at all. They were like, you can be a supporter, you can be a counselor. And I was like, oh, great. And then they were like, oh, here's your supervisor. She's an IBCLC. Girl, I'm on Google. Like, what is that?
Right. Right.
It's a mouthful, but I have no idea what that is. And that was kind of cool. So I was like, oh, what are these requirements? How do you do that? I love the clinical side of wellness and really being able to like, not just make it about I want to say the friendly side, but really make sure that people are actually healthy and like these babies are actually eating. And when there's something wrong, there's someone clinically skilled enough to actually help. I wanted to be on that end. And so I was looking at all those requirements, the like 1,000 supervised clinical hours, these 14 health science classes that I already had, thankfully, looking at the lactation specific education. So kind of just finding my way, checking these boxes until I could sit for my boards. And I was able to do so. So I went through all this lactation training, went through all this doula training, sat for my board so I could become a board certified lactation consultant and really just committed to learning about the field.
Yeah.
I'm like, how do people do this? Like what is the landscape of all of this like in my area? At that point, I was working heavily in DC. Right now it's pretty equal in DC, Maryland, and Virginia, but I didn't realize how everything was connected. I'm like, how does your midwife or your provider during pregnancy or OB connect to the hospitals and the birth centers? I'm like, how does that determine what kind of support you get postpartum? Where do you go to like get your baby help when they're not doing well? Where do you go to get lactation help after you leave your birthing facility? I was literally like running around in these streets and these organizations being like, well, who teaches that? Like, how do you teach this? And got so much experience doing so, but also got a really deep understanding as to this shit ain't simple.
Right?
I'm like, we're not set up to win. I'm like, where do we win at? Because this isn't really working well.
Yes, yes.
It was so crazy.
Yeah. I wanna just kinda jump back just a couple of points that you made. I want you to drop what are those top 5 reasons? What are those top 5 reasons for those who don't know, who might not have breastfed or those who want to breastfeed, who will see
Yes.
this? Drop them gems for them. Let them know. What
Yeah,
are
and I'll mention a couple more because there are a couple more that I'm like, y'all need to pull this out.
Yes.
So really big ones, cancer, breast cancer, ovarian cancer, reducing our risk. And the longer that we breastfeed, the longer that we're making human milk, the
Mm.
more protection we have. Then we have bone health, like heart health, bone health, cancer. Those alone is like, come on now,
Yes, yes,
help yourself.
yes.
Help yourself. Then we start thinking about diabetes, right? So that is a huge one, especially in the Black community right now. We start thinking about, okay, what are our risks of developing diabetes? What's the risk of developing them after we had gestational diabetes?
Mhm.
Breastfeeding is helpful. Then there's this new data on like Alzheimer's and reducing our risk for Alzheimer's, which is
Wow.
really huge. None of these are my favorite, by the way. My favorite,
Sure.
my favorite,
Charnise. Those are good, but I
those are
mean,
great. Those are great.
but I got a favorite one.
My favorite is the antibody response that human milk has because it's alive and we're alive and it's
Mm,
living and our babies are living. And it is literally responsive to our environment in order to cater the milk that we produce to protect our babies.
mm,
Not even us for real. So, for example, during COVID, I was hospital based during COVID at one of the hospitals in DC, where honestly, I feel like that hospital gets the catch all of everything. If it
mm,
exists, we got it,
mhm.
including some of the first COVID patients who were expecting and who were birthing and who were positive while birthing and all this other stuff. And so we're like, well, what do we do?
Mhm.
Because we got to make policy on figuring out how to support these people. And I'm like, we let them breastfeed because if anything is
Yes.
going to have an antibody, it's going to be our milk.
Mhm.
And we learned that that was the case, which was really awesome. I got a lot of pushback in the beginning on that one, but
Really?
I'm always so much. Oh my goodness.
And what were
Because
some of the arguments or,
it's
that people
fear-based medicine is absolutely ridiculous, and I
mm,
understand it to the point of like a lot of times organizations are worried about liability
mhm,
and they're worried about optics and all of this other stuff, and I'm worried about, well, how am I going to get her milk supply to come in if she can't see her baby because y'all want them separated because she's positive,
mm.
but y'all finna send them home in the same car?
Make it make sense.
Who about to teach her how to latch this baby on if you don't want me to come in? Or so let's get suited and booted. It's like,
Yes.
what? Oh
Yes.
my gosh. Arguments were like, okay, well, they're separated, but we're gonna do education virtually. We're gonna have them watch videos on education. So we're gonna send them home together and there's gonna be no home visiting. Excuse me? Lord, the tables is crazy. Being at the tables are crazy.
Yes, absolutely. Absolutely. But I'm grateful that you fought for this because not only, just like you said, your top 5 plus reasons, right? Breastfeeding is so important, but I am a witness to how IBCLCs are just amazing,
Yay.
dope people because I had 2 for both of my boys
I
and I'm
love
still
that.
nursing now, my
Yes.
almost 2-year-old, you know?
Yes.
And so when I tell you, when you're sitting there and you are crying and your baby is crying and you looking at that baby and that baby is looking at you and y'all are
Yes.
having a whole moment and you got to call your mama on the phone, which was me. I don't know what I'm supposed to do. She said,
Yes.
don't you worry about it. And I feel like, when you are in this field, I feel like everything just left my mind. I'm a doula. I'm a birth worker. I have been doing this. I just like you, I have seen most of my friends Thundercats. Okay. Most of them. Okay. Cause I have been there with them. But, especially by the time I had my almost 2-year-old, it was a little different with my son who's almost 11. Okay. So
It's
we need
very different.
to get the boys together. Okay.
Yes.
But a phone call that made so much difference, an hour of time for someone to
Mhm.
come into your home and really be with you at another vulnerable and sacred time to really turn things around for
Yeah.
you. Allowed me to breastfeed for 13 months with my 11-year-old until he woke up one morning and said, "No, booby mommy. No, I'm good."
You know?
To this one who is almost 2, who is like, "Mm-mm, I ain't getting off. We just gonna ride this thing on out." But then you
Yes.
look at the benefits, and you say, "Okay, we're gonna work it out. We're gonna give it some more time." I'm grateful. And I'm grateful
I
that it's
love that.
IBCLCs that look like you that are out here helping us,
Yes.
because it's not a lot of
It's
y'all.
not a lot. It's not a
No?
lot. It's definitely less than, I wanna say it's around 6% now. I
Mm,
wanna say there was an improvement in the past couple of years, but it's definitely less than 10% of us as IBCLCs who are Black, and that's just, it's not enough.
yeah.
It's not enough at all, especially when we think about who's who's having babies, yeah?
Mhm,
I'm
mhm.
so glad you were able to even access an IBCLC. I mean, I feel like that is always a big conversation, like how do we even get the help that we need? Like
Mhm.
where y'all at?
Right.
And how y'all do this?
Yes.
And so I'm just glad. And we also get a bad rep all the time. People be like, y'all crazy and pushy and being too much. And I'm like, some of us might be, but not all of us.
Yeah, but what I find is that you are specialized in this field for a reason, because you guys are great at what you do, and you see things that the pediatrician who's in the hospital may not catch, or may say, "Give it some time and it'll be okay," right? Or you guys just have to figure out your rhythm. Well, the rhythm issue is that the baby has a tongue tie. So, Kim,
Yes, yes. And I
right.
love that you mentioned that because a lot of times people assume that pediatricians are the experts of infant feeding because they're
Mhm.
the expert of the infant.
Yeah.
And we come in a space now where our medical system is very specialized.
Mhm.
We really know what we know and we don't know what we don't know.
Yeah.
And it takes a lot for people to do warm handoffs when they know, like, hey, this is actually over my head. I don't know what's going on.
Mhm.
And when you look at the amount of required infant feeding and specifically breastfeeding education
Mhm.
that doctors have to have, it's about less than like 3 hours, five
Wow.
hours. Hopefully, they are just interested in it and go out on their own and get more. But do
Mhm.
they have to learn about breastfeeding in this particular way? In terms of like how are we latching on baby? How are we assessing milk
Mhm.
transfer, all this other stuff? No, they don't have to.
Yeah.
And so when we look at like these required 3 to 5 hours, and then you look at my 1,000 clinical hours, my 90 specific educational hours, 10 years in the field, it's different. And it's
Yeah.
like, I love to see collaboration so much. There are people around here that do it beautifully. But
Mhm.
sometimes people don't. And I want the people to know that, like, just as the doctors are responsible for our care, we're responsible just as much, if not more, right? Like,
Mhm.
it's our bodies, it's our babies, it's our families. Like, we really need to go hard and get
Mhm.
the support and help that we need. And it takes a lot of kind of wiggling around to figure out what that sweet spot of support is and
Mhm.
how we access it. But
Right.
it's so worth it.
Yeah.
It's so worth it when it happens.
Yeah. I definitely agree. And that's one of the things when I'm speaking with clients and talking to them is that remember that you are the advocate of your own health, right? This is your body. This is your baby. But most importantly, too, you need a team. Your GYN, your OB is not the end all be all. Your pediatrician is not the end all be all. This is integrative wellness. This is a
Yeah.
team approach. And just like you said, the people on your team are specialized in certain areas to be able to step in and help you find solutions to whatever that specific issue is that you may be having. Whereas you just relying solely on your primary care doctor or your OB is not the best for you or your baby to receive those wraparound services, to receive that support that you need. You need some people on your team, and it starts in the beginning. It starts before you find out you're pregnant. It starts as
Yes.
soon as you get the positive pregnancy test. It starts
Absolutely.
whenever it starts before the baby gets here.
Absolutely. We don't understand that enough. I'm always like, oh, we need to hit up these college kids, hit up
Yes.
these high schoolers
Yes.
because the decisions that we make in those periods of time, it's even just who we're getting care from,
Mhm.
that is such a huge decision. Like the preparation is not enough. And honestly, I don't think people are ever ready for these little kiddos. I think it's a whirlwind regardless.
Yeah.
But there is a level of preparedness that we can get to, which helps tremendously.
Absolutely, absolutely. Hey, so did you have any more reasons? I know you probably have a lot, but did you wanna add, any more to the list? We can run it back.
Yeah, run it back. There's a
Let's
lot
run
of
it back.
reasons. So
Okay,
the cancers
reduction,
are a big one. Yep. Breast cancer, ovarian cancer, heart disease, stroke is one. I don't know if I mentioned that before.
heart
That's
disease,
really
I'm writing
big.
it down.
Yes.
We
Of
have bone
course.
health,
Bone health, that's a huge one. These are all mom related. I'm like, forget the kids.
because mom has to be healthy in
Mom has to be
order to
healthy.
show up for the kids
Yes, we
and
got to be here
everybody
for a
else,
while. We
right?
have to be here for a while,
Yeah.
for sure. We have the immune system responses
Yes.
that breast milk provides. I'm
Yes.
always like, if the whole family is sick, we can pass around some shots now.
Right.
We can we can throw it in some oatmeal,
Yes.
okay? Throw it in some
Yes.
tea,
Yes.
throw it in
Yes.
some cereal. It's
Yes.
here.
Yes. And it's doing amazing work.
It is.
It's
It
doing
is.
amazing work. Like if I haven't seen it, if I never saw it before, I have witnessed it myself when, my little one, I don't even know how he got this respiratory infection and not RSV. We it was just something we don't know where it came from because he's home with me. So I don't know where it came
That's fair.
from, right? But he stayed on the boob. And I know that that cut down the time that it took him to heal.
Yeah.
And he, after maybe like the first 1 or 2 days, was a little lethargic and tired. Then he might not have been on 1,000, but he was on 800, right? And even though he wasn't eating solids a lot, like he didn't really want, I don't want to chew any food, but
You
I
know.
definitely will nurse. I will nurse. And
Yes.
I do see and know that that really helped him, not just in, like you said, the protection and that antibody response, but also the comfort. Because, when you don't feel good, you want somebody to cuddle with you and hold you tight, make you
Yes,
feel good.
absolutely. Absolutely.
Yes.
Absolutely. And we don't hold these babies enough. So yes, we're always
Yes.
trying to mess them away. I'm like, you need to hold these babies. They need
Yes.
hugs. You
Yes.
can tell when they get to about 5. You can really tell when they get to 30. They need some hugs.
Yes, yes, yes. So you went to school, you did all your hours. Breastfeeding has been your love, your joy. And so would you say that that is where do you spend the most of your time working in lactation, or is it about the same amount of time working with clients being a doula?
I think it depends on the season. Nowadays, it definitely feels more 50-50, which I'm not sure how I feel about that yet. See, I'm always like, let's see how we feel about this flow. But most of the days, I am supporting folks with infant feeding, whether it be doing like 48 hours a week, 4 to 8, not 48, 4 to 8 hours a week at my local hospital down the street for lactation support. A lot of the time, oh my gosh, so much throughout the week, I'm doing home visits for lactation, and that is where I am just the happiest. It's really just meeting folks where they are in the thick of it when they're going through all of the changes that are happening, especially within the first week after delivery when it comes to infant feeding and breast health and how the milk is changing and coming in or not,
Yeah.
and really figuring out the challenges that they're dealing with. So a lot of my time is in that space. I teach some classes virtually and in person when it comes to prenatal education. So
Mhm.
I'm doing that as well. And then, of course, like there's my doula clients. So we
Yeah.
are
Yeah.
thugging it out when we're at deliveries,
Yes,
and
yes.
we are yeah, doing all of
Yeah.
our prenatals, our postpartum follow ups. It was crazy in the last few days because what's today? Today's Thursday.
Mhm.
That's how you know it was bad. I'm like, oh, day it is. Wednesday, that morning, I was like, "Oh, I need to" well, hold up, maybe not Wednesday. I guess it was Tuesday. It was Tuesday. So
Mhm.
Tuesday morning, someone that reached out, a local doula, so we went to have, like, coffee and tea together that morning, and then I had 4 home visits that day, and it was a lot, which I don't usually like doing, but I was like, "Ooh, these are so fun and so fulfilling,"
Yeah.
and it was, like, folks that we've really been working with for a while, and
Mhm.
everything was going great, and I was like, "Okay, yes." I really like this. So I had my home visits, and the last one ended around 6 o'clock. And I was like, ooh, I'm by my favorite restaurant. Let's go eat something good. Got something to eat, a little glass of wine. Went home to lay down, and maybe like an hour later, it was like, this thing is banging, and we need to figure out what's going on. I was like, shoot, I'm tired. Let me take a nap.
And that baby was like,
My baby was
no.
like, no, your nap is it's gonna be a quick one.
Yeah.
It's gonna be a quick one. Yep. So then I went to meet my clients at the hospital. We were there. Labor was roaring. So they were
Mm,
having some complications. So we had to slow things down and figure it out. She
yeah.
ended up laboring all yesterday. I probably got home at midnight, and I was
Mm.
back at the hospital down the street by like 6:37. So we are moving.
In the streets, for
No, for
sure.
real. I tell people I'm in the streets all the time. They're like, you're being dramatic. No,
Yes, yes,
I'm
yes.
out here.
Yeah. So walk us through what a call looks like to you and what does a home visit look like when you come to visit?
Yes.
Yeah. For people who
Oh my
don't
gosh.
know, let's just run it back. Let me just run it back. What is an IBCLC? What for people who don't
Yes.
know what that is, what the acronym is, and then run us through what it would look like if we put in a consult for you to talk
Yes.
to you and you came to a home visit for us.
Yeah. So an IBCLC is an international board certified lactation consultant. It is the highest designation when it comes to infant feeding and breastfeeding support in the world, which
Mhm.
is where that international part comes in. I love to distinguish that because I want folks to know that like our expertise is not just based upon how we run our healthcare systems in the US or what some of our organizations, like our health organizations in the US, represent or preach. Ours is international, and we are taking the world view when it comes to public health and the health of our families and our babies. Okay. So I'm always like, we are not in this tunnel.
Mm,
And so that's what an IBCLC is. We do so well when it comes to like teaching what's normal. Like this is what we expect to happen, but we are best when it comes to the unexpected. So when we are having issues that are making infant feeding difficult, whether it be someone who wants to exclusively bottle feed and has all this milk coming in and they're like, how do I get rid of it? We're
mhm,
great to call when the milk is not coming in and it's not increasing and they're concerned about if their babies are getting enough after we come in. If our babies have special needs and they need help when it comes to infant feeding and they
mhm,
need special tools to be able to do it or a specific type of assessment to make sure it's going well, we're who to call. When your babies are small and in the NICU and came a bit early and we're trying to figure it out and they're not taking feedings by mouth yet, but we're trying to transition into
mhm,
getting to that place where the ones to call as well. And so there are so many situations. I'm always like, if you are not sure if we can help you or not, but it is about infant feeding and it is about babies and it is about milk, maybe about bottles, maybe about pumps for the ones. So
mhm.
definitely we can help pretty much all people. I'm like, I got something to teach everybody who has a baby when it comes to feeding, even if you're just formula feeding. We could
Yes.
talk about how to sterilize some powdered formula so we're
Mm,
avoiding all those risks that come when we hear about these formula shortages and babies getting sick because of factories and stuff like that. We can talk about paced bottle feeding so we're not overfeeding our babies. When we have losses, our bodies don't always know if we lost our baby. And our
mhm,
bodies are responding and sometimes making milk. And when people are navigating that space, trying to figure out what to do with the milk when the baby is not around, we're definitely the ones to call for that as well. And so sometimes people are like, oh, we're just for people who breastfeed exclusively. And it's like, we're for FPR folks.
yes, yes.
Yeah. So that's who we are in a snippet of what we do. And when people come to me, sometimes it's from different places. Sometimes it's
Okay.
from referrals from birth workers, from hospitals, from pediatricians. Sometimes people find me on social media. And when we have a home visit and get to schedule a home visit together, it's really just me, one, being honored that you're welcoming into your space,
Mhm.
taking my shoes off at the door because my mama raised me right.
Right?
Really just looking at all the things that are happening at the moment,
Mhm,
looking at the perfect picture, like if this went the way that you wanted it to go, what is that and what would that look like? So we're
mm,
doing some imagining together.
mhm,
And then we're connecting the dots. where we're really just analyzing what is happening, where we want to be, what are our challenges and difficulties,
Mm-hmm.
and making a plan together that is realistic for one, but also flexible. Like things don't always have to stay the same if it's not working out.
Yeah.
And we game plan together. I assess the baby. So I always have my scale with me. So I'm weighing baby, doing oral assessments, doing anatomy assessments of baby and mom, or baby and birthing person, baby and parent, looking at how they're doing things. I'm always like, show me how you do this.
Mm-hmm.
I'm never going to be like, my way is the only way. That is
Mm-hmm.
never a thing.
Mm-hmm.
And if it works, it works. And if you
Mm-hmm.
love it, you like it, I love it.
Right.
So we really go with the flow. I want them to show me how they're doing things, the tools that they use. I love it because we're using their couch, their bed, their pillow, and all the things that they have access to versus me
Right.
being like, buy the thing. No, we don't need to always buy the things. We got things. So let's use the things that we have
Right.
and let's make sure we can use it to the best of our abilities. Yes, we're going through all of that. I love when there's family around during the consult. I love the
Mm-hmm.
partners, the other parents, the grandparents, the siblings. I'm like, who has a question?
Hello, Indigo Womb family. Unfortunately, we lost the last 30 minutes of this amazing interview with IBCLC Charnise Littles. Please check her out, especially if you're in the Washington, D.C. metro area. Her information will be listed in the description below. Again, thank you for supporting us, and we look forward to growing with you and bringing you more amazing interviews with other birth workers, spiritualists, herbalists, and all of the amazing people that are supporting our community.